Are you struggling with unexplained weight gain or weight loss, constant tiredness, or changes in your heart rate? Many people dismiss these symptoms as stress, aging, or lifestyle issues, but often the real problem lies in a tiny gland in your neck, your thyroid. In this video, we'll break down everything you need to know about thyroid disease, the difference between hypothyroidism and hyperthyroidism, the most common and hidden symptoms you should never ignore, how thyroid issues affect your heart, weight, skin, and fertility, and what treatments can help you live a normal, healthy life. Stay till the end, because I'll also share the exact warning signs when you must see a doctor immediately. The thyroid gland is small, butterfly-shaped, and located at the front of your neck. Despite its size, it plays a massive role in your health. It produces two main hormones, T3, triiodothyronine, and T4, thyroxine. These hormones control your metabolism, how fast or slow your body converts food into energy. When your thyroid works properly, you feel energetic, your weight is stable, your skin and hair are healthy, and your body temperature stays balanced. But when it malfunctions, producing either too much hormone, hyperthyroidism, or too little hormone, hypothyroidism, your entire system feels the impact. Let's start with hypothyroidism, when your thyroid doesn't produce enough hormone. This slows everything down. Metabolic changes. The most common symptoms are fatigue, sluggishness, and unexplained weight gain, even if you're eating the same diet. Many people also struggle with brain fog and trouble concentrating. Temperature sensitivity. Hypothyroid patients often feel cold all the time, even in warm weather. Skin and hair issues. Dry, rough skin, brittle nails, and hair thinning or hair loss are red flags. Some notice the outer edges of their eyebrows thinning out. Digestive problems. Chronic constipation is another sign. Menstrual and fertility issues. Women may experience irregular or heavy periods and difficulty conceiving. Other signs: puffy face, swollen legs, muscle cramps, joint pain, or a hoarse voice. If untreated, hypothyroidism can lead to serious complications like infertility, depression, heart disease, and in rare cases, myxedema coma, a life-threatening medical emergency. On the other hand, we have hyperthyroidism, when your thyroid makes too much hormone. This speeds everything up. Metabolism. You may notice sudden weight loss, even with a good appetite. Some feel bursts of energy, but also crash with weakness and fatigue. Temperature sensitivity. People feel overheated, sweaty, and uncomfortable, even in air-conditioned rooms. Nervous system, tremors, anxiety, irritability, restlessness, and even insomnia are classic symptoms. Heart symptoms. A fast pounding or irregular heartbeat is very common. Some patients describe feeling their pulse in their neck. Other signs: muscle weakness, lighter or missed periods, and in severe cases, a thyroid storm. A thyroid storm is a medical emergency. Symptoms include high fever, vomiting, delirium, and a dangerously rapid heart rate. If this happens, seek emergency care immediately. Here's something many people don't realize. Your thyroid and your heart are directly connected. Too much thyroid hormone can cause atrial fibrillation, an irregular heartbeat that increases your risk of stroke. It can also trigger tachycardia, or a very fast heart rate, which strains your heart and can lead to heart failure. Too little thyroid hormone slows the heart, causing bradycardia. Patients may feel dizzy, faint, or unusually weak. In some cases, the heart muscle enlarges, a condition called cardiomyopathy. In fact, many people only discover their thyroid problem after being evaluated for heart issues. What causes thyroid problems? Hypothyroidism causes Hashimoto's disease, an autoimmune condition, is the most common cause. Iodine deficiency, common in regions without iodized salt. Congenital hypothyroidism, where babies are born with a weak thyroid. Hyperthyroidism causes Graves' disease, another autoimmune condition. Thyroid nodules that produce excess hormones, excess iodine from diet or medications like amiodarone. Risk factors include being female, over 60 years old, having a family history, or having another autoimmune disease like diabetes, lupus, or celiac disease. How do you know for sure if you have a thyroid problem? Your doctor will start with a physical exam, feeling your neck for swelling or nodules. Then, they'll order blood tests to check levels of TSH, T3, and T4. If needed, they may also check for thyroid antibodies to see if it's autoimmune. In some cases, imaging tests like ultrasound or a thyroid uptake scan are used to check for nodules or an enlarged gland. Treatment depends on the type of thyroid disease. Hypothyroidism is treated with a daily pill, levothyroxine, a synthetic thyroid hormone that restores balance. Hyperthyroidism can be managed with antithyroid medications like methimazole, radioactive iodine therapy to shrink the gland, beta blockers to control fast heartbeat and tremors, or in severe cases, surgery to remove the thyroid. Patients then take hormone replacement for life. With proper treatment, most people live completely normal, healthy lives. So, when should you worry? Call your doctor if you notice unexplained weight changes, persistent fatigue, anxiety, or insomnia, irregular or very heavy periods, swelling in the neck, or any unusual heart symptoms like palpitations, irregular rhythm, or chest pain. And remember, if you ever experience symptoms of a thyroid storm, fever, confusion, vomiting, and rapid heart rate, seek emergency care immediately. Your thyroid may be small, but it has a big impact on your health. The good news is, thyroid disease is treatable and manageable. The earlier you catch it, the better your chances of avoiding complications. So, do you think your symptoms might be thyroid-related? Drop a comment below. I'd love to hear your story. Don't forget to like, subscribe, and share this video with friends and family. Someone you know may be struggling with thyroid symptoms without realizing it. Stay healthy, and I'll see you in the next video.